Thank you so much, everyone, for joining us today for our Asian American Health Promotion and Allyship in Williamson County webinar. My name is Melissa Tung. I'm the Director of Quality and Strategic Management for Williamson County and Cities Health District. And we are excited to present this webinar to you in partnership with Austin Asian Impact and Aspire to Age. And so, next slide, please. Thank you. So just a little bit of information about Williamson County and Cities Health District. We are Williamson County's local health department, and our mission is in partnerships with community to protect and promote the health of people in Williamson County. We also have our Healthy Williamson County Coalition, which supports community partnerships as activities in improving the health of Williamson County together. So I'm going to turn it over to Mega, who will just briefly describe our partners today for this webinar, Austin Asian Impact and Aspire to Age.
Thank you, Melissa. Austin Asian Impact focuses on strengthening the work of local leaders and organizations by recognizing the impact made by Asians in their communities and mobilizing support through social impact. And Aspire to Age focuses on understanding values and prioritizing the importance of culturally diverse lifestyles. They are supporting our communities through the aging process with quality and trustworthy care. I'm looking forward to seeing and hearing the panel as well.
Thank you, Mega. So today we have some wonderful community leaders to kind of help us navigate the conversation around what the Asian American landscape looks like in Williamson County, also identify health needs and what can be done to strengthen partnerships in the community. So I would like just really quickly to cover their bios. First off, we have Alice Yee. She has been mobilizing Asian American and Pacific Islander communities in Austin for over 25 years. In 2014, she founded APAPA and became the Southeast Regional Chair that year. She also leads the Austin Asian Community Civic Coalition that engages community from Austin to San Antonio. So we are super excited to have her. She's also done a lot of work with the census in 2020, and that's kind of where I got to meet her then. Our second panelist will be Shibuta Saxena. She is the president and founder of Aspire to Age, which focuses on building cultural appropriateness in services. She also founded the South Asians International Volunteer Association in 2008. She serves on the Austin Asian American Quality of Life Commission and mentors candidates to increase diversity in boards and commissions around the Austin area. And lastly, on our panelist, we have Wei Nguyen. She is a nurse, BSN, MSN, and she is currently the General Secretary of the Austin Vietnamese American Medical Professional Society, who has been serving this area for the past 21 years. And she also was formerly with Ascension Seton Williamson and Ascension Seton Austin. So before we get started, I just wanted to find out a little bit more about you. So we're just going to do a quick poll. First off, kind of what role do you play in your community? And then on a scale from 1 to 5, how confident are you in connecting with Asian American community / leaders to address Asian American health? Okay. I am having issues with my polling. Kelly, can you see if you're able to activate the poll?
I don't have access.
Okay, how about, since the poll is not working currently, kind of since this is a pretty small group, would people like to kind of share what role you play in your community, and also like how confident do you feel like you are in connecting with the Asian American community? And you can feel free to post it in the chat also. How about Kelly? Would you like to start us off?
Yeah, I feel like for me, I do a lot of community building and partnership development and those types of projects, but I don't feel confident at all in connecting with our Asian community. I don't think we've really connected with any organizations or have made that deep connection yet, and then just don't quite have enough knowledge about the population yet to better serve them.
Thank you. See, Mega said she's a health advocate. Another person said she is a volunteer with health literacy, dog rescue, health education. From the chat, there's also frontline staff with the breast cancer community, some community building, some preparedness, volunteer populations, not confident. Another person said, not confident as I would like to be. Let's see, there's also about outreach and health advocacy to community, but not confident in being culturally sensitive or have the language skills to address the Asian American community. So thank you all for sharing. It seems like we all have different roles we play in the community, from volunteer to being on the frontline staff. It seems like a majority of people aren't as confident. And so hopefully this webinar will kind of help you increase your confidence, at least for myself also, on how do we better engage our community residents, our Asian American community residents. Okay, so we're gonna jump into the panel. And so the first question we would like to ask our panelists is for Alice Yee. So through your work with the census, what can you tell us about the Asian American population here in Williamson County? I'm curious to hear about what population growth looks like, and also if you would like to touch upon the model minority myth.
Thank you first of all, thank you for inviting me for this panel. And thank you for all the audience to pay attention to build allyship with the Asian American. And the great question, Texas gained more than 4 million citizens over the past 10 years, this from census. And the increase is about 16%, that's all total population. But the Asian population instead grow 66.5%. So now making up about 6.6% of total population in Texas. But in Williamson County, total population grew 44% from 2010 to 2020. I have this data is according to the congressional district. So I pulled out a couple of congressional districts that went through Williamson County, like congressional district 10, the Asian population changed up to 113%. So now the population is almost 64,000. The congressional district 17 changed about 53%. Now it's 42,000. Congressional 31 district and growth 171.5%. Now it's over 64%. Now it's 64,000. So looking at all those numbers, you will be surprised. Asian American really grow really large in the Williamson County. And coming back to the Texas House, I think 52, House District 52 is in Williamson County in Round Rock area, which grew 166.15%. So that's a really surprising change. And to Asian Americans, there's another number I want to share with you. Totally, there's 150,000 undocumented AAPIs live in Texas. People always think about the model minority math, Asians doing well. Actually, people really overlook the Asians in undocumented. We have refugees, we have undocumented. Those people have really need help, especially healthcare, especially representation in all different field. I have this AAPI data information and really shows this undocumented has a health issue, all kind of health issue and all kind of outreach need us to pay attention. So I stop here, and in case you need some question about where my data come from, I will share in the chat, so y'all can study with this data information.
Great, thank you for sharing that, Alice. Yeah, and even as we were doing some research and as we were doing our 2022 community health assessment, I was very surprised as to, yeah, that the Asian American population is rapidly growing in Williamson County. And we, yeah, need to tailor our services and our infrastructure to addressing the needs of the Asian American population as well. And so Alice just posted a link that says, for those that aren't able to see the chat, it's aapidata.com/policy/health-care. And we can post that with the webinar as well. So the next question I have is for all three panelists, and feel free to take turns. Why is it important to engage the Asian American community?
I can go first if you like me to. Can you
Yeah,
hear me
for
okay?
sure.
Okay. Well, this is Wei Nguyen, and I am a nurse, and the reason my bio was so short because I officially retired in September of last year. However, I kept my license current so I can get involved into the community activities. Experience-wise, I have been working in the healthcare field for nearly 40 years. So I have had the privilege of experiencing the forever changing healthcare over the past few decades. We talk about working in the healthcare field. We all feel that to engage the Asian American community in the healthcare process is important, as fighting gap in health disparities among this group is vital, simply because we would want to bring healthcare awareness, education, medical screenings, and in order to successfully providing an inclusive basic medical care to this vulnerable population. To me, if we are not engaging them, not encourage them to be engaged into this healthcare process, we are missing out a huge boat, because in order to have a successful treatment, a successful plan of care for the clients, any clients, you've got to understand their culture beliefs, their culture differences. No matter how wonderful your plan of care for that particular client is you plan for, it won't be as effective as understanding where they at with their culture belief. And again, it takes a village to do that, not just the doctor, but it takes the whole medical team, from the doctors, the nurses, the pharmacists, OT, PT, I mean, you name the whole team to support the client's belief and to support the plan of care for them. So it is very, very important to me to understand the concept, their belief, and especially their needs.
Yeah, I can share a little bit also. I mean, I can divide up the things into just the wellness profession, you know, whether it's physical need or mental, emotional, behavioral needs or spiritual needs. The Asian American community is quite different sometimes. In the physical health needs, the examples include things like when you need a Gujarati speaking, speech therapist, somebody who's had a stroke, right? Where do you find that? Unless you're engaged with the community, there's no way for you to find out who can you involve in that process. The mental emotional health needs, there are so many examples, right? Like whether we have performance anxiety of a student that you're dealing with in your school district, and how do you, deal with their emotional issues. behavioral health, we have so many people who come to us who've gone through anxiety, depression, who's gone untreated because of the cultural aspects that we have, where we don't have words sometimes to express our behavioral needs, and there's no way to get treatment. There's a lot of hesitancy. And then the spiritual side, of course, there's so many different faiths that are represented. Unless you understand the belief system of that person, no matter how much you try, you're not going to be able to give the care that is needed. We had an amazing example of a Syrian refugee who came here, was bombed in the war, and did not understand consent that we have to give in America. So she did not consent to the doctors to take tissue from one part of her body to fix the other part, which was shattered. So now she lives with a shattered foot and a lot of pain. So there's a lot of reasons why I say engaging with the community to make sure that they're healthy. Of course, we have a lot of professionals in the space too, with the disparities. So connecting with those professionals who can be there to serve is also very important. So there's many reasons why I need to engage with the Asian American community. Thank you.
Well, my opinion is look at the data I shared early. Since the API community growing so fast, become 6.6% in Texas total population, and our voice, it matters now. And Asian culture and most immigrant, and we don't have the mentality to get involved with civically. That's why our organization APAPA and AACC is trying to helping to ally our build a coalition with our API community to get out to vote, to be counted. And so there's so many Asian American, like I said earlier, need help, but we usually don't speak out, don't speak aloud. So the policymaker, some of the data, not even showing our data. So many mainstream data information disclosed not include Asian American at all. That's why that we want our local, everything start from local, from everybody else here, and to tell your ally, to tell your friend, colleagues, to try to reach out. There's a lot of Asian Americans, but Asian American has another information is we have all the language barriers. The first generation Asian Americans, the refugees, and they don't understand the English, and they speak a second language at home. So this is the barrier to be engaged. And I especially need to say something about a couple of organizations in need of a volunteer, in need of donations, and if you can, to become a supporter. AFSA, which is stand for Asian Family Support Services Austin, that's the only Asian American organizations to support our family violence and sexual abused people who need help. And there's another organization called Light and Salt Services Austin, who helps Obamacare enrollment, Medicare, Medicaid, and it does cancer support. So all these great organizations, and they really directly in the front and in the grassroots community. If you want to outreach to them and to help them, to donate your time and your effort to connect with them, and so that would be wonderful.
Great, thank you so much.
Melissa,
Sorry, Wei. Yes.
Do we have time? I like to just piggyback on what Alex just said about the language barrier, and also the difficulty of the refugees and the Asian American population are facing with. I like to give an example of the COVID pandemic. At first, everybody, the majority wanted to get the vaccine. And in order to get into the system to register at first, as we recall, was the most challenging task for everyone, let alone if you are Asian American with the language barrier. So I was very thankful for APA staff to help me to register a group of people to have their vaccine. And then following after that, we at AVAMS partnering with Williamson County and APH to conduct or to hold several vaccination events. It actually took a village again. The process was not that easy without the support from the community volunteers. I'm talking about Mega herself and her group. Again, we had Burmese population, we had Indian population, we have Vietnamese, Chinese populations, Hispanic included, and everybody else. It took a village to get the help, the translator, the transportation itself, but together we pulled together as a whole group, as a community, and we were able to provide the vaccination for the needed population. They were just held where they had access to the site, or if not, we were willing to get volunteers to provide transportation and translators as well. Alice had mentioned about the API. I think it's very, very useful program. When I have time, I do participate just to see how we are with the information given through the presentation. And it's very useful. The challenge that I've seen is, again, the access to the device. Like, do they have a phone that they can click on? Do they know how to click on the link to get into the system to listen to it? Now, the translators are just wonderful. Of course, I can only speak for Vietnamese speaker, and I can understand her. It's just wonderful. It's very thorough, and we do appreciate that very, very much. We do also appreciate the fact that they send out the heritage, the cultural, the heritage survey. Alice has said, all voices need to be heard. And that's what we need to encourage the community to participate. And how are we going to do that is a challenge for us, for all of us. Thank you.
Thank you so much for sharing, Wei. I had a follow-up question in the sense, how did you reach these specific populations, like the Burmese, the Vietnamese? Did you already know of community champions, or did you already have relationship through organizations? How were you able to connect with them even with language barriers?
Yes, thank you for asking. I am from the Austin Vietnamese American Medical Professional Society. It's a handful, so I will refer it to as AVAMS. So AVAMS has been in the Austin area for 21 years this year. So I'm very proud to say that for every single year we have held the annual health fair to the Asian population, and except with the exception of last year. And even this year, we hope to do a condensed version just because of the current Delta pandemic. And again, we hope to connect with other people. And how do we hold an event like that? Now, our AVAMS event, the health fair event, normally have the participants from 200 to 400 participants in 4 hours, because we have provided a lot of general topics that really touch base to what people are having problem with or dealing with, those simple things every day they are dealing with and not know how to get any help. So we have medical consult, we have medication consult, we have food assessment, we have a UT health group to help with the doing the cholesterol and blood sugar for everybody. We have we have relationship with a group of dentists and vision as well. So we get help from them to do a few screenings. We don't provide treatment or anything like that, but we do provide screening. And from that, we can actually lead them to the link so they can go to see a physician or refer them to the clinics. Now, to hold an event that big, we do owe the big thank you to the whole community, to Vietnamese community in Austin. In short, is for VCAT. A lot of volunteers, hundreds of volunteers at one time to help, to translate, to guide, to answer questions, to help with the forms, the consent. Alice has said, about the consent as well. How do they sign their name if the consent is in English? We do have volunteers to translate and to make sure they understand what they are signing their name under. Now, I want to shift gear a little bit because I worked in the hospital system. There is a wonderful service called the phone translation service. And those services are very, very useful in different languages. When I worked in the hospital previously, I have utilized the service, and it certainly eases anxiety of the clients, knowing what's going on with their plan of care, what's the treatment they're getting, and what kind of procedure they are consented to. So that was another service that's very, very helpful, and that eases the client's anxiety easily. Let me see, other organizations like AACC, we do try to reach out to other organizations in the community. Unfortunately, that our members are very limited. We are busy for work, we're busy with some different reasons, but we are very, very limited. I'm just hoping that whoever we are reaching out to, we will get the support. And for the past 21 years, we did, and I believe that we will. As in October, I mentioned that we will do a condensed version of the health fair. Main thing is we like to give out the flu vaccine and also COVID vaccine, whether the first time, second time, or hopefully the booster, according to the guidelines. And if we get the support, it's still pending the response from our resource yet. So again, those are the things that we try to advertise on Facebook, on our homepage, AVM's homepage, on Facebook, flyers. I do physical flyers, and we go around all the Asian centers and the markets to post them. We ask the restaurant owners if it's okay to get their permission to post a poster. And, that's how the participants turn out just from those means. Thank you.
Thank you so much. So kind of a follow-up question, and I think Wei, you kind of addressed some of it. For the three of y'all, what do you think the Asian American community needs in regards to maybe physical health needs, mental health needs, or just in general, like support? I think a lot of us need like tangible things that we can like work off of. So
let me start with this, what we need. We need allyship, we need support. You all heard about Stop Asian Hate movement. The reason, because everybody has to go back to thinking about 150 years. Asian American was discriminated. All people of color was discriminated from American society. And people of color cannot become a US citizen. And also the 1882, Congress passed the Chinese Exclusion Act. Until last few years, when pandemic started and the past administration started talking about blame on China, blame on Chinese. So our whole Asian was hit. Everybody in our community was worried. We worry two reasons. We also worry about COVID, just like everybody else does. And second, we worry about Discrimination Act, the violence, the discrimination. And all this is from our community's affair. Even we are so population growing, and the discrimination did not get easier on us. So we need, for especially this kind of time, we really need allyship. We need support from a mainstream. We need support with all different communities. And we need to build a coalition with the people of color. In United States, immigrant contribute so big deal, so grateful. And we were here 200 years ago. So we did not come in here just for right up for the freedom. And we were built railroad, we built the all kind of leadership. We're talking about now high-tech CEOs and grassroots, the restaurants, markets, all these people, you will see, not too hard to see so many service members are from people of color. So please, if you don't know any friend of Asian community or Latino community, or Black community, reach out to them, reach out to just Google it, what organization they have. We have so many organizations. By the way, I want to advertise that next Tuesday is a National Voter Registration Day. We're all going to go out to register more voters to get involved civically. So you all can, I dropped a couple of links there and my personal email, reach out to us, and we need as many friends as possible, and this can lift everybody up. This is American value. Thank you.
Thanks, Alice. We definitely need a voice, right? Because as a newer immigrant community, you know, we're growing in numbers, but we've kind of supported ourselves in the past. And now we're finding that we need to come together and connect with all the cultural groups here, as well as have a more systematic method for caring for ourselves. I mean, Hue has done an amazing job with the AVAMS, and Alice has done with the Chinese community, and Megha and other people in the South Asian community, but we're sort of doing it in silos. So I agree that the need to come together, and I have a short presentation that I can share with you at this time that I had put together, and about this allyship and the work that we have to do, right? We're talking about 3 action items of visualize, actionize, and then mobilize, so that we can connect our cultures in the right manner. So let me just a second. Here we go. So in connecting the cultures, Austin Asian Impact is the organization that we're forming, so we can bring all the Asian American community together and allow for people, for us to see ourselves and other people to see all the wonderful organizations that we have and the groups that are doing the work, like AVAMS, like APAPA, like AACC, and then allow the mainstream community to connect and with that and take actions with them. So connect with these leaders and these organizations, and then mobilize, because the work that we are doing as volunteers is good when we are small, but as we grow, there is a real need for us to invest into this community so that it is done in the mainstream and done properly. So Austin Asian Impact is focused on the 3 parts: visualize, actionize, and mobilize. And they're using some tools to do that. So in the visualization tools, we are creating guides for the community, whether they're services that AVAMS provides, or they're nonprofit organizations or professionals that are in the wellness space, different events that are held up, some collaborations. So there is this one tool that we use called Observable. So it creates diagrams like this, which is a zoomable circle packing diagram. We're looking at different ways to visualize the data, so all of us can have access to the data and then make it useful. The other tool that we use is one called Kumu, K-U-M-U. This was done by UT, and it's, again, the same information about different kind of guides that we're building out, whether it's nonprofit guides or professional guides for caregivers or translators and interpreters, so that if you need a Burmese interpreter, you can come look at this guide and find them and go to it. The third tool, because these are tools that allow you to observe the data and learn from it. So there might be some contact information given, or there might be events that the community is doing. So we've created various guides, like by region of Asia, by language that they speak, or by the faith, whether they're Muslim. We have 9 different faiths that we've identified, and 94 organizations that are faith-based that you can go to when you want to do vaccine outreach. So while we're gathering the data, this is another view that you're taking by impact. So it'll tell you by impact area, whether it's arts, culture, humanities, civic empowerment, community development, and then what are the organizations like AAEN or AI or API. There's just a lot of, we have more than 300 organizations that are nonprofits that are listed here, and what they're doing. And so AVAMS will be one of them, and the wonderful events that they're organizing will be listed down here. So you can go look at them, take a look at it, and then it can also be made actionable, not just viewable, but actionable. So in order to do the actionization, not just visualization, we're going about it in 3 different ways with the Asian community. One is through the people, because the stories that we've talked about, right? Well, the communities were small, we talked about stories, whether there's a language-based issue or when you have to do vaccinations, how do you organize? There's a huge disparity, as Alice mentioned, between the population groups. There's people like us, like me, who've come here as an engineer and have been accepted into society, have a lot of resources and connections. But there are people who come in as refugees, who have language barriers, come as older adult, and their caregiving is an issue. So AI is taking such case studies, and we are highlighting it and creating a booklet of such case studies of local people. So we organized some Ready, Set, Care series this year to focus on that, whether it's behavioral health or refugee experiences. So there's several such case studies available that you want to look at and understand what are the issues that Asian people are going through in their wellness situation. The other thing that we're doing for actionization, not just the people and their stories, but gathering a list of professionals and services. So not just the allopathy specialists, but social services, alternative care, frontline. So we are building out, whether if you're in a Japanese space, or if you're spiritually, you focus on yoga, or different ways, whether it's Tai Chi that helps you, so that all of the different methods of wellness, the services that are provided are visualized, and then they are made actionable, so that you can go to, and if you are looking for a cardiologist, you can go find one, or if you're looking for a free health clinic, you can find one. So this is a wellness resource guide for Asian Americans, Asian American wellness. So people, professionals and services, and then the organizations part. While we have over 300 Asian American led or serving organizations, nonprofits and groups, we have about 27 or so, 26 or so that are wellness focused, in the specific impact area of health and wellness. And we have tried or estimated saying how much money is being raised or used, what are the gross receipts for the year by these organizations. If we don't have data, by default, we've taken a number of $50,000, which is, I think, any nonprofit that is operational, right, is doing the amazing work. Like, we don't have data on AVAMS, right, other than the year that it was started, right? So we have just put in a number of, so you'll see that this is a very low number, but even cumulatively till now with all these organizations, we're seeing less than $2 million investment in Central Texas around the wellness and those organizations that are being, doing all this amazing work. And we are soon going to be 10% of the population in some of the districts, like Alice was sharing, right? We're going from 6% in Texas to some of the specific areas that we're talking about in Williamson County. We are much higher in number, soon to be 10%. So we see that the investment that's being done in this area is very minimal. So we'd like to share with you the list of these organizations and the wonderful work that's being done. AI is already working with several organizations. This is a very small list. NAUHC, the North Austin Universal Health Clinic, is a free health clinic that operates in Williamson County, and they take anybody who walks in the door, no questions asked, and they provide the services. The city of Austin is funding some of it now through the Quality of Life Commission. We have asked for it. So now I think Williamson County needs to see what we need to do in terms of free health clinics that are available for Asian Americans specifically also. AACC, I think Alice mentioned about, they have language-based health navigators. They're Asian American Community Health initiative. So they work on community health, whether it's specific Korean, Vietnamese, Burmese, Arabic navigators that are available so that they can help these people navigate our health system, which is very difficult to navigate. We also have ABHN, which is more on the behavioral health side, so Asian Behavioral Health Network. It's a provider directory and a resource for professionals when they want to reach each other. So we're already working with these, but we want to prioritize what is happening in Williamson County. Alice mentioned light and salt services, which allows enrollment in health insurance, which is a very important part of your healthcare. We also have refugee or faith-based services through organizations that we collaborate with. But all these collaborations are happening at an informal basis. We want to work on it to systematize it and bring funding or whatever the organizations need. Currently, AI is helping these organizations create their websites or just advertise their services, help community ambassadors get trained so they can put up Facebook in messages about getting vaccinated, or last year when the census has to be done. So how do you create a video? How do you put it up on a social media so your circle of influence is influenced by that? So the third part I want to talk about: visualize, actionize, and then mobilize, right? So once we have the data, we have made it actionable to reach specific organizations or community leaders. We also want to mobilize by being a case partner or enhancing a health framework that we are working on. So how does Williamson County look at their health? What is it that they want? And then we want some collaboration to raise a minimum of $5,000 is all I put in, just to start working on this data and the case studies and the framework, so you can see what Asian American health looks like in Williamson County. There is funding, but we need to bring all of these collaborative partners together, the 26 or 27 organizations. So this is what I had. There's a lot of different visualizations that we worked on. I'm not going to go through this. This just gives you a quick description of how South Asian nonprofits have started, and they're all growing. So we all need to, make sure that we participate and make it possible for us to collaborate around that. That is the ask. So in short, we do need your help to participate in us coming together with you. So the allyship that Alice said, and it comes with a little bit of time as well as the money that's needed to ramp up these organizations who are doing amazing work. Thank you.
Sapara, that is very powerful PowerPoint presentation you just did. It is wonderful to know all the services, and I couldn't help but admire your engineering background with all the data collection and all that. As we can see, as I see myself and our small group, is that we are the healthcare provider worker. So we just do it. So data collection is one of our lack of help. I like to take this opportunity to see that if anyone would like to join AVAMS, that would be wonderful to get some help. Of course, if you know Vietnamese, that would be a bigger help too. Again, I really appreciate the slides that you just showed us, and it's wonderful to know and to be aware of all the resources out there, should we need to reach out and to tap on resources to help other people. Thank you.
Yes, thank you so much to the panel for answering that question. I've seen some of Shibuta's guides and didn't realize how many organizations are connecting with the Asian American community, in regards to temples and language specific organizations. There are so many, and thank you so much for compiling that and making that accessible. I know we have a couple more minutes left, or I wanted to see if any of our participants had any questions in regards for the panel, maybe if you've had a challenge in connecting with the Asian American community, or if you had a question about a specific health topic. We would love to take questions or just even have a dialogue with our panelists, because I feel like we don't always have this time set aside to have discussions like this. So yeah, feel free to put in the chat, or if you would like to ask a question, feel free to unmute.
have a question. And I'm curious, I know because Williamson, sometimes we feel like there's not as many, like the resources are growing in Austin and not so much here in Williamson. And I guess because we're starting small and have that $5,000 goal, like how do you see organizations, I guess you've already answered like how we can support, but if we don't have all of those organizations that are in Austin here, how do you see is the best way for us to start getting those discussions going if we don't quite have all of that momentum yet?
I mean, I think most of these organizations that I said operate in Williamson County too. They're Central Texas based. I don't think they're limited to Austin at all. Austin has started funding some of these things through Austin Public Health or other resources so that they are connected. And when they have a need for vaccine outreach, they already know. So we would love for Williamson County to get, the $5,000 is just to get started. We have an intern that we're getting from UT, for example, and they're going to gather some data and put it together based on whatever Williamson County needs, right? Because Wei's organization, I don't think I think they do serve in Williamson County, right? Am I correct? And I know Alice definitely does.
Yes, for AVAM, we do. We started out in Austin. That's why we have the Austin Vietnamese American Medical Professional Group. However, we do serve in Williamson as well if there's the need for that. One of our first experience to partner with Williamson County was the COVID vaccine events. And, we were so thrilled that we had that opportunity. So we hope that in the future that Williamson County, staff can reach out to our organization to just let us know what help or what support or assistance that you need in terms of reaching out to the Asian community, not just in Austin. Thank you.
Yes, a lot of organizations has a name says Austin or AACC, but actually we serve Central Texas. If you go on the website aacc-atx.org, you can see our coalition. All those coalition name listed on there, and they serve all Central Texas, which include Williamson County. We're really not divided by Travis County or Williamson County at all. And doesn't matter which area, and I know light salt and covers a lot area. And sometimes his county clients come over to them too, just because they serve Obamacare and enrollment. So just reach out to those organizations to either volunteer with them, to see what you can do, and to build a collaboration. Thank you.
There was another question. So we have at the health district, we have something called a medical reserve corps. So like a volunteer base of healthcare professionals and just community members that want to rally around different health issues. Are there specific needs in the community that could benefit for this? I know Wei mentioned like volunteering with AVAMPs. Do y'all think of other ways or potentially other ways in which we could partner through volunteering?
Well, I think not only volunteering through AVAMs, but the availability of the translators, the navigators, as Alice has mentioned, and also that the literacy, health literacy, the written material in different languages. There are a lot of, I can only speak about Vietnamese because I can read it, that yes, a lot of materials that we need to streamline, we need to make it much more simple for people to be able to read it. And I'm pretty sure that with other population as well, that the simplest that you make the reading material, the better for participant to understand and to read it. So again, I would like to see that there would be some organization or some volunteer groups to translate in different languages. And when we say translation, really streamline it, not to do the whole page of information. Sometimes it's just too much for the population to read it, and we won't get the compliance. And
My answer, Melissa, would be absolutely yes. I mean, when we started out SEVA, South Asians International Volunteer Association, it was supposed to be it is a volunteer association where we do intergenerational volunteering. So we gather a lot of volunteers from within our communities, but the important part is to partner or do events with other community groups, whether it's corporate business resource groups or the MRC that you just talked about, right? The collaborative volunteering, I think, is extremely important and each of these organizations would welcome partnership in their volunteering in the allyship, because then you can work together, whether you have Asian, professionals from corporations that are volunteering to put the data together or to help connect the people, or, make sure that they get rides to their doctor's appointments or other things, right? I would love to understand a little bit more about what the MRC is there a specific set of volunteer activities that they perform that we can encourage our community to participate in, or and how does that work? I'd love to understand a little bit more.
Yeah, I can just speak from a little bit from my experience. So we have an MRC coordinator at our health district, but we have different, Tim has done a really good job at creating different teams to support different initiatives. So for example, when we were doing like our COVID pods, our vaccination sites, a lot of MRC volunteers came to help out with that, running these different types of activities. We've done like, work with like senior centers and volunteers, like even writing cards, like kids writing cards and things like that. So just a lot of different ways in partnering that. And it's definitely grown a lot over the past year and a half in regards to COVID. And so I think it'd be awesome, even just, we've never put out a call to like people to volunteer their language experience. I'm pretty sure there are people that are in Williamson County that are fluent in multiple languages, and being able to do that would be a great opportunity. So,
do they provide transport as well? Because I know I have somebody in Williamson County right now who's going for dialysis who will definitely would love that help, because they're calling all our community members, so yeah, absolutely. Those collaborations, I think, so these service requests, right, for volunteers or, paid, opportunities like which are available, so that Williamson County people and all these 300 organizations, when they have a need, the tool that we have built out, and this is through Aspire to Age, who's also, a partner in this thing, we're building out the tool called Keep Fluent. So you can reach these organizations and request a service of them, whether it's a volunteer-based service or a paid one, right? So that is also possible.
Great. Thank you so much. Does anyone else have any questions before we kind of wrap up our webinar today? Or if the panelist has any like last thoughts, I think.
I don't have any question, but I do like to express my wishful thinking about having a volunteer hotline for crisis. When people actually trust you, trust your organization, trust the people that they know, they call you. Personal experience, the reason I'm saying it, because I have had a few phone calls, not necessarily they speak Vietnamese, it's all sort of, the Americans and people that I know at the middle of the night and saying that, hey, I just feel so anxious. I have suicidal ideal. And that was just like, whoa, woke me up immediately. So again, it's just something for us to think about my wishful wish about having a hotline, volunteer ones, just to have this and other available services. Thank you.
Actually, AFSA has a hotline and with 35 different languages supporter to answer the hotline 24/7. But it's not limited to Asian only. They not reject any kind of services, and basically with the family violence and sexual abuse victims.
Oh, that's wonderful to know. Thank you.
Okay, I'm going to just share a couple of things that we had started the last time. Melissa, I know that you had participated in the case studies that we were doing for behavioral health, right? Just because this topic came up, we had come up with a framework called Behavioral Health Framework, which was there's a crisis emergency, the awareness network, self-help support network, levels of care. We had actually worked on this sort of a framework, and where we had 911 and then other crisis emergency situations, organizations, then hotlines that we've talked about. And I would love to put this together in a list where we have all of the different resources that are available and the groups that are doing awareness building as well as peer support, those kind of things into a chart that all of us can connect and refer out to each other or request of each other. So thank you, Melissa, for participating the last time and starting to build this out. Just wanted to make sure that people were aware that this work has started, and we would love your support and help in continuing this, completing this net framework that we think should be there, and making sure all the organizations and groups providing this are connected. So that's where I would leave this. And my last thought will be, I appreciate that all of you have come together and we want to continue building this wonderful collaboration that we have here for allyship with Asian Americans.
Great. Thank you so much, Alice, Wei, and Shibuta for sharing. Mega, do you mind pulling up the PowerPoint as we just wrap up in our last 3 minutes? Thank you. So in regards to just action items and next steps, we would love to continue to gather data, as Shibuta mentioned, to identify specific gaps among Asian Americans in Williamson County. A lot of times, like we mentioned, either data is not available or it's all the Asian groups are lumped together. And so we would love more actionable items for that. 2 would be identifying case studies to dive deeper on topics to solve. 3 would be adopting information/resource guides that are already available, but how do we better disseminate and how do we better organize and collaborate together on that? And then lastly, would love for you guys and also for us to continue to get connected to Asian American leaders working in Central Texas. There are connections available. And so if you need more conversations with one of our panelists, or would you like to continue this conversations with Williamson County and City's Health District, we would love to continue to do so. And so I will just, since the poll does not work, feel free to chat kind of how confident you feel now after the webinar. I know it's just the first step in this conversation. And also, what do you think your first step will be? Feel free to put that in the poll. And then lastly, I'll just send out, the last slide is my contact information. So if you want to get more involved, if you want more, just another person to chat with, feel free to contact me at my email, melissa.tung@wilco.org, and also visit our website, healthywilliamsoncounty.org. That is it. Thank you so much, everyone, for participating in our webinar. We'll send out all the follow-up information after this. Thank you once again for our panelists. Thank you for taking time out of your day to talk with us today.
Thank you for having us.
Thank you. It was my pleasure to participate.
Thank you. I hope that the group that joined got something out of this and will continue to do so.